Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to like this video. Please feel free to leave suggestions, feedback, or questions in the comments section below. Also, you can visit my website, championshipchiropractic.com, where you can get additional information on the book and also where you can connect with me on my other social media sites. Please enjoy this sports medicine video. Today's episode of Dr. Ozello's Sports Medicine Report is about Tarsal Tunnel Syndrome. Now, you may be asking yourself, what the heck is Tarsal Tunnel Syndrome? Tarsal Tunnel Syndrome is impingement of a nerve right down here causing symptoms into the foot. Tarsal Tunnel Syndrome is nicknamed the Carpal Tunnel Syndrome of the foot because there are so many similarities with Carpal Tunnel Syndrome and Tarsal Tunnel Syndrome. Tarsal Tunnel Syndrome occurs when there's impingement of the posterior tibial nerve. Posterior tibial nerve, sometimes it's simply called the tibial nerve, and it is a branch of the sciatic nerve. And that nerve runs right down here and gets impinged, and then we get symptoms into the foot. To better understand this common condition, I'm going to give you an anatomy lesson. This big bump right down here is called the medial malleolus. The medial malleolus is on the inside part of the ankle, what we call the medial aspect, and it is the lower part of the big bone in the lower leg, which is called the tibia. So the medial malleolus is very important in tarsal tunnel syndrome. The posterior tibial nerve, like I mentioned before, posterior tibial nerve runs behind the medial malleolus, which is medical terminology posterior, and it runs inferior to the medial malleolus. The medial malleolus has a structure right here called the flexor retinaculum, which is a strong fibrous structure that runs from here and attaches down to the heel bone, in medical terms known as the calcaneus. The posterior tibial nerve travels underneath that. If the posterior tibial nerve gets pressure put on it from the flexor retinaculum, or it gets impinged upon somehow underneath there, it will cause symptoms into the medial aspect of the foot and the medial aspect of the lower part of the foot, known as the plantar part of the foot. So the symptoms in tarsal tunnel syndrome are on the inside part of the foot or on the inside part of the bottom of the foot. The reason this condition is called tarsal tunnel syndrome is because the posterior tibial nerve travels through the tarsal tunnel when it is underneath the flexor retinaculum, and that is where the impingement occurs. Also, there are two branches that come off the posterior tibial nerve. There are four strong ligaments, collectively known as the deltoid ligaments, that connect the medial malleolus to various bones in the foot. Ligaments are strong structures that provide stability to the joint. The symptoms of tarsal tunnel syndrome sometimes they're very hard to pinpoint. They may be in a sort of diffuse type of an area. They're going to basically be along the course of the posterior tibial nerve and its branches, which is going to be located underneath or posterior and inferior to the medial malleolus on the medial aspect of the foot and the medial aspect of the plantar part of the foot. Again, like I said, it's very hard to pinpoint and say this is where it hurts at. So you have to think about that because there's an impingement on the nerve, so there can be pain along that entire course of that nerve. Now, these symptoms, they can be pain, like sharp shooting, shock-like pain, burning type of a sensation, numbness, tingling. Whenever there's numbness or tingling, that altered sensation, that can cause the person to have an altered gait, so they can limp. You may also notice that they may want to push off a little bit differently than how you usually do. Also, there can be weakness in a variety of ankle motions. These ankle motions, weakness can be in what we call inversion, which is turning of the ankle inward. There can also be weakness in toe flexion, which is curling of the toes. In a long-standing case, there can be atrophy in the muscles in that area, and also in a long-standing case, whenever there is weakness, there can be a negative effect when we're pushing off, because those toes and the feet and the ankles just aren't as strong as they should be. Tarsal tunnel syndrome is a common sports injury. It is most common in athletes who are runners, hikers, jumpers, and climbers. All four of those activities require a great deal of strength, stability, and motion in the foot, the ankle, and the lower leg. So we want to make sure that those areas are very strong, very flexible, and as stable as they possibly can. This condition is also slightly more common in females than in males. This is a condition where when direct pressure is placed on the nerve that is impinged, it can increase the symptoms. So you think about that. If you're wearing tight socks or tight shoes, or if you tap on it or direct pressure is placed on a nerve, that can increase the symptoms of tarsal tunnel syndrome. Also, the symptoms are usually worse during any type of weight-bearing activity. The symptoms usually decrease when we're resting, but they do get worse at nighttime. So those are things that you have to consider when there is a nerve impingement condition such as tarsal tunnel syndrome. The mechanism of injury of tarsal tunnel syndrome can be traumatic or non-traumatic. In traumatic, it is just a direct impact to the posterior tibial nerve. This can occur in a sport like baseball, where someone gets hit with the pitch or maybe gets kicked during a slide. This can occur during football or basketball when that area gets stepped on. It can occur during soccer with the kick. So there's a wide variety of ways there can be direct impact to the nerve. But most likely, in most cases of tarsal tunnel syndrome, it is a non-traumatic mechanism of injury. In the non-traumatic mechanism of injury, tarsal tunnel syndrome is an overtraining injury. It's an overuse injury. And I've talked about this before on most of my videos, but when we have an overuse injury, there are three principal factors. There's too much training, inadequate rest between training sessions, and some type of biomechanical fault. So we have extrinsic factors, which is the things that are occurring outside the body. That's the overtraining and the inadequate rest. And then we have the intrinsic factors, things that are occurring inside the body, which are the biomechanical fault or biomechanical faults that lead to this condition. When we speak of tarsal tunnel syndrome, the biomechanical fault, the intrinsic factors that can lead to it are several different things. First of all, weakness in the foot, hyperpronation, when someone steps down. Every time we step, our foot will, if this is the right foot, we step down, our foot rolls inward and downward slightly. When that happens too much, that is called hyperpronation. That can lead to a great deal of pressure being placed on the tarsal tunnel, being placed on the posterior tibial nerve as it's going through the tarsal tunnel. Also, pes plas, which is flat feet. There's weakness in the feet, there's poor biomechanics, so that can also lead to this condition. Also, if there was a prior sprain in the medial ankle ligaments, I had mentioned these ligaments before when I spoke about the anatomy, but if there was a sprain in this area and these ligaments did not heal properly, that leads to poor biomechanics in the foot that can place additional stress on the muscles and the structures in the foot and the ankle, and can lead to the impingement of the posterior tibial nerve. So if you have an ankle injury, especially if it's a medial ankle injury, you want to do everything that you can. You want to do a very comprehensive rehab to make sure that this area is functioning well and you have completely recovered from that injury, so it will not become a contributing factor to tarsal tunnel syndrome. Also, when there's weakness in any structure, not only the ligaments, it can be the muscles, it can be the ligaments like I mentioned, that can be a predisposing factor for an injury in that area or in the surrounding areas. Because if a structure is weak and it's not carrying its workload, another area will have to have an increased workload, and that can lead to pain or symptoms in that area. So we want to do everything we can to eliminate the extrinsic factors. So we want to make sure that we train hard, that we train smart, and we give our body adequate rest between training sessions. We also want to do everything we can to eliminate the intrinsic factors. So we want to make sure that we strengthen the feet, we strengthen the ankle, we strengthen the lower leg. And we want to make sure that we can have proper motion in those areas. We want to make sure that everything is as strong as possible and functioning and moving as strong as possible to help to prevent tarsal tunnel syndrome. When we speak of prevention of sports injuries, we want to make sure that we are eliminating both the extrinsic factors and the intrinsic factors. As I mentioned before, you want to train hard, but you want to train smart, and you want to make sure that you're recovering from your training sessions. You also want to make sure that you're giving your body that proper fuel, so you're eating well, you're taking good supplements, so that you are providing your body with the tools it needs to grow and to adapt to your training and to recover from your training. So you get the maximum benefit from your training, and you also prevent injuries. Now, when we speak specifically about tarsal tunnel syndrome, first of all, things outside of training. You always want to look at your footwear. You want to make sure that your footwear is giving you proper support. Ladies, if you have any issues with the feet or with the ankles, you want to avoid wearing the high heels. It puts a great deal of pressure on the foot and the ankle. So if there has been an injury, or if you feel you have instability or weakness in the ankle, then you want to avoid wearing the high heels. When we speak about training, you always want to make sure that you're wearing good shoes that are going to give you the support that you need. Now, there's a wide variety of great footwear that athletes can use. Find what works for you. That's the easiest way to say that. Find a pair of shoes or a type of shoes that works best for you. It's going to give you the stability that you need, and it's going to allow you to train the way that you need to train. Now, we want to eliminate any of these intrinsic factors. So we want to eliminate the weakness in the feet. We want to eliminate the instability of the ankle. We want to eliminate these biomechanical faults like I spoke of. We want to lessen their negative effect. So you want to strengthen your feet. You want to do foot strengthening exercises, things like the towel toe grab, the short foot exercise, toe splaying, toe curling. I'm going to create a playlist with this video, so there's going to be all types of videos that I have done that are going to have a variety of exercises and strengthening exercises and stretching exercises that will help you in the prevention of and rehabilitation of tarsal tunnel syndrome. We want to make sure we strengthen the feet. We want to make sure that we improve what's called proprioception. Proprioception is the body's awareness of where it's at in nature. You do that by training on an unstable surface. You could use a wobble board, a rocker board. You can use a Bosu ball. Another factor that is important in the prevention of tarsal tunnel syndrome is strengthening of the ankles. I had already spoke about doing proprioception exercises on an unstable surface. Excellent exercise. But now what I'm speaking about is doing more of resistance band exercises where you're going to strengthen the ankle in a specific motion. Those will help a great deal in strengthening the muscles and the ligaments in the ankle. So you want to concentrate on not only doing our weight-bearing activities with the Bosu ball and the rocker board and the wobble board, but doing specific motion strengthening exercises with the resistance band, and those are going to help a great deal. Now, if symptoms should occur, you want to take action immediately. I know I say that during every one of my videos, but do not hesitate to take action when you start to feel any type of symptoms that you think are tarsal tunnel Syndrome. Now, the reason I say this is because this is a nerve impingement condition. Nerve impingement conditions are progressive. This will get worse if you don't do anything to take care of it. The areas will get weaker, the numbness, the tingling will become more frequent, it will become more intense. So you want to make sure that you take action immediately. Now, there's several types of self-treatment that you could do. I do recommend that you get professional care just to make sure you get the correct diagnosis and to set you on a proper path for your treatment. As a doctor of chiropractic, I have treated Tarsal Tunnel Syndrome in my office. As a doctor of chiropractic, I treat many different nerve impingement conditions, and Tarsal Tunnel Syndrome is no exception. What I would do if someone came into the office and they had the symptoms of Tarsal Tunnel Syndrome after I did the consultation and the examination, the report of findings, in the treatment, I would look at the entire chain. I would adjust the spine so we get the proper nerve flow coming from the spine, going all the way down the lower extremity and coming right back up without any interference. Then I would look at the pelvis, I would look at the hips, the knees, the ankle, the entire foot. We want to make sure that the entire chain is working the way that it should so we can restore or reestablish proper skeletal motion and optimize the nerve flow. Now, there's things that you can do on your own to provide yourself with some treatment for Tarsal Tunnel Syndrome. Many of these are the same things that we talked about with the prevention. Strengthening the feet, stretching, and doing range of motion exercises for the ankle. Strengthening the ankle, where you're doing resistance band exercises. Strengthening the ankle, strengthening the feet with proprioception type of exercises where you're on an unstable surface. That is going to help you a great deal. Strengthening the feet is something that I always stress. I have a video on that I do recommend that you watch. There's 4 basic exercises that will help you a great deal to strengthen the feet. It's going to help to limit the negative effect of hyperpronation. So strengthen your feet, strengthen your ankles, provide range of motion exercises to the ankles, stretch the calf muscles and the Achilles tendon if needed. It's going to help you a great deal in the prevention and in the rehabilitation of Tarsal Tunnel Syndrome. Also performing what's called nerve slide exercises. Nerve slide exercises have many different names. I like to call them nerve slides. You may see the terminology of nerve glides, neural mobilization. You may see nerve flossing. Either way, it's going to help to break up scar tissue that may be encasing that nerve to another structure. When we move, the muscles slide and the nerves slide over each other. There should be fairly free movement. When there is a nerve impingement, that movement is limited or basically ceases. So scar tissue starts to form and it encases that nerve to another structure. So we want to break up that scar tissue and allow that nerve to flow the way that it should. So that's why I like to call it a nerve slide, because the nerves and the muscles will be sliding the way that they should. Like I said, it doesn't matter what you call it, nerve slide, nerve glide, neuromobilization, neuroflossing. The objective is the same thing, and it is to free that nerve from encasement of scar tissue so that the area of impingement will be limited, or the amount of impingement will be limited so that the nerve signal can flow the way that it should. And I do have some videos that you will see in the playlist that will help with Tarsal Tunnel Syndrome. There is one that is very specifically a nerve slide exercise for Tarsal Tunnel Syndrome. So you want to include the nerve slides in your self-treatment, in your rehabilitation of Tarsal Tunnel Syndrome. In conclusion, first of all, I want to say thank you for viewing my video, Dr. Ozello's Sports Medicine Report, with the topic being Tarsal Tunnel Syndrome. If you have questions, if you have suggestions or feedback, please leave them in the comment section. Also, please feel free to like this video. Tarsal Tunnel Syndrome is a chapter in my book, Running, Maximize Performance, and Minimize Injuries. It's on page 119. This is a condition that can be very painful, it can be performance limiting, and it can have long-term sequelae if not treated properly. Any type of nerve impingement condition, you need to take action immediately. Do everything you can to eliminate the extrinsic factors and the intrinsic factors to prevent this condition and to rehabilitate yourself from this condition. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Train hard, train smart, stay injury-free, and accomplish your goals. Thank you for viewing today's episode.